You're 9 months pregnant. There is no hospital, no painkillers, no doctor, no sterile room. Just you, your tribe, and the most dangerous moment of your life. What happened next is why half of human history is missing. Because for 300,000 years, women were doing something that seems impossible. Giving birth without any of the tools we consider essential today. And yet, somehow, the human species survived. The question isn't just how they did it. The question is, who helped them do it? Here is the uncomfortable truth. Human birth is uniquely dangerous compared to every other primate. Our babies have massive heads relative to our pelvic openings, a consequence of two things happening at the same time: walking upright, which narrowed the pelvis, and evolving larger brains, which made the head bigger. The result is the tightest birth canal of any species on Earth. The mortality rate without any help was staggering. Estimates suggest that without intervention, roughly 1 in 3 women died in childbirth throughout human history. 1 in 3. So tribes had to solve this problem. And they did. With something that predates agriculture, predates civilization, predates almost everything we consider modern. The role of the midwife. And we have proof this role is ancient. In 2014, researchers analyzing Neanderthal remains found evidence of skeletal injuries consistent with someone who spent years kneeling and supporting laboring women. These weren't just helpful bystanders. These were specialists. Women who had seen dozens of births, who knew techniques for turning breech babies, who understood which plants reduced bleeding and which positions made delivery easier. They were the first medical professionals in human history. The moment a woman in a hunter-gatherer tribe realized she was pregnant, something shifted in the entire group's behavior. She didn't become isolated or sidelined. She became the center of an intricate support network. Anthropologists call it cooperative breeding. Other women in the tribe, especially older women who had already given birth, immediately began adjusting their roles. They took over more of her physical labor, brought her extra food, started sharing knowledge that had been passed down for generations. This wasn't charity. This was survival strategy. When a woman went into labor, the tribe didn't panic. They had been preparing for weeks. A specific location had already been chosen, usually away from the main camp, but close enough for safety. Somewhere with soft ground access to water and natural shelter. Archaeological sites across Africa and Europe show evidence of these birthing areas. Small clearings with unusual concentrations of tools and burned plant remains. The laboring woman was never left with just one person. Typically, 3 to 5 women surrounded her, each with a specific role. One midwife managed the actual delivery, checking dilation and position. Another supported the woman, physically letting her lean back or squat while holding her weight. A third prepared warm water, medicinal plants, and tools. Others kept a fire going and watched for predators. Because labor could take hours or even days, and the sounds attracted attention, the woman almost never lay on her back. That is a modern hospital invention. Instead, she squatted, kneeled, or stood using gravity to help the baby descend. Modern studies confirm that upright positions reduce labor time and pain. Ancient humans figured this out 300,000 years before the studies did. The midwife used her hands to feel the baby's position, guide the head, and prevent tearing. If something went wrong, if the baby was breech or the cord was wrapped around its neck, these women had techniques. Archaeological evidence and modern hunter-gatherer studies show they knew how to reach inside and turn a baby. How to cut and tie umbilical cords with stone tools. How to apply pressure to stop hemorrhaging. These weren't guesses. This was refined knowledge passed from generation to generation. When the baby finally emerged, the infant was immediately placed on the mother's chest, skin to skin, exactly as hospitals recommend today. But the ancient practice went further. The placenta was delivered and carefully examined, because experienced midwives knew a retained placenta could kill. The umbilical cord wasn't cut immediately. They waited for it to stop pulsing, allowing all the blood to transfer to the baby. Modern medicine rediscovered this as delayed cord clamping. In the 1990s, ancient midwives knew it 50,000 years ago. Then came the recovery period. And this is where the community structure becomes even more critical. The new mother didn't return to normal work for weeks, sometimes months. Other women in the tribe brought her food, helped her nurse, took care of her older children. This wasn't optional. This was embedded in the social contract. Because anthropologists studying the Hadza people in Tanzania and the Kung people in the Kalahari found that women who received this support had significantly higher survival rates, both for themselves and their babies. The community wasn't just being kind. The community was keeping the species alive. The tribe also had protocols for when things went wrong. If a baby was born not breathing, midwives knew techniques for clearing airways and stimulating breathing. Some infants could be revived. Others couldn't. And in those cases, the tribe had mourning rituals. Burial sites from 100,000 years ago show infant remains buried with care and ceremony. Proof that even failed births were treated with reverence. Here is something most people don't know. Ancient midwives were also pharmacologists. Researchers have identified over 50 plant species used by indigenous cultures for childbirth that contain compounds with real pharmacological effects. Some plants induced labor, some reduced bleeding, some reduced pain. This wasn't random. This was accumulated knowledge tested across thousands of generations. Here is where it gets interesting. A 2017 study published in the journal Birth analyzed the outcomes of over 15,000 births. They found that women who had continuous support from another woman during labor had 25% shorter labors, were less likely to need interventions, and reported significantly higher satisfaction. The researchers noted something specific. The effect was strongest when the support person was experienced but not medically trained, exactly like ancient midwives. Modern hospitals with all their technology often isolate women during labor, attended by rotating staff who don't know them, in sterile rooms, often without family present. The ancient model was the opposite. Women were surrounded by people they trusted, in familiar places, supported by specialists who had known them their entire lives, and the outcomes when birth went normally were remarkably good. Studies of modern hunter-gatherer groups show that when labor progresses without complications, maternal and infant mortality rates are comparable to industrial nations. The high historical mortality rates came from complicated births infections and hemorrhaging, situations where modern medicine makes a massive difference. But for the vast majority of normal births, the ancient system worked. It worked because it was built on 300,000 years of accumulated knowledge passed from woman to woman, refined through trial and error across thousands of generations. Here is the part that changes everything. Women's knowledge systems, including midwifery, were oral traditions. They weren't written down. And when colonization and industrialization disrupted indigenous cultures, much of that knowledge disappeared within a generation or two. We lost tens of thousands of years of refined expertise in about 50 years, but fragments remain. In 2019, anthropologists working with the Ake people in Central Africa documented birth practices that likely stretch back to our common ancestors. The Ake midwives still use techniques positioning, plant medicines, and support structures that mirror archaeological evidence from sites 40,000 years old. They represent an unbroken chain of knowledge spanning the entire history of our species. Modern medicine has been independently rediscovering what ancient midwives already knew. Delayed cord clamping, rediscovered in the 1990s. Upright birth positions, confirmed by modern studies. Skin-to-skin contact, now standard hospital practice. Continuous emotional support, now called doula care, proven to improve outcomes. Ancient humans figured all of this out without laboratories or clinical trials. They figured it out because birth happened constantly, and the tribes that developed better systems had more surviving children. Evolution didn't just shape our bodies for birth, it shaped our social structures around it. So here is the question. When you think about a woman 9 months pregnant today, surrounded by monitors and medical staff in a sterile hospital room, remember this. Her body is designed for a process that worked for 300,000 years without any of that technology. The ancient women who survived didn't survive because they were tougher. They survived because they were never alone. They built communities that caught them when they were most vulnerable. And those communities created the first specialized knowledge systems in human history. The missing half of human history isn't gone. It's in every culture that still honors the role of midwives. In every woman who supports another through labor. In every tradition that treats birth as a communal responsibility rather than a medical procedure. Your ancestors survived the most dangerous moment of their lives not because they were different from you, but because they understood something we are only now beginning to measure scientifically. That the most powerful medicine was never the herb or the technique or the tool. It was the person beside you who had been there before and knew exactly what to do.